I mean, I'm not in a laboratory actually doing it, but I think that you're really microscopically trying to look at an identifiable gene like we have in other fields. We've traced cancers, for example, to a specific gene, and that research is being done, and that's why the money is important that people raise to work on those sort of things. I'm sure the same thing will occur with the arthritic component, because I think there's no question that I see it in families over and over again. And I think what I'm talking about is the arthritis, which is the garden variety kind of wear and tear arthritis. Now, other forms of arthritis, rheumatologic arthritis, for example, that's pretty well, clearly shown to what the physiology is behind that. And there's been tremendous work done in the last 25 years as far as drugs that help treat that particular condition, which affects more than just joints. And I think that the question will be, what happens if we find the gene too? Right. What are you going to do about that? Because I think then you might have an ethical decision to make, and it's not pie in the sky, I think, anymore. That if your 6-day-old has had their blood drawn and you do the screening and you find the gene, do you start doing some genetic manipulation of DNA at 6 days old to avoid arthritis in the future? Yeah, that's a whole different discussion, from ethical, and from every other standpoint. I think it would be preemptively, because I think that we kind of know that we can't treat arthritis short of a replacement. There's really nothing else out there, and thank God we have that, because 50 years ago I told people like this, tough luck, we can't help you. So I think it has to be preemptive strike, I would think. What the mechanics of that are, I'm not sure yet, but I think it would involve some sort of genetic kind of manipulation, and the question is that ethical to do? And again, I'm not in the laboratory as far as the details of that, but I suspect there's going to be some sort of genetic substitution that will delete out that gene and have a blocker gene or a spacer gene or something along those lines to fill that void, and in theory remove the possibility that you will have arthritis in your lifetime. I don't think that's crazy anymore. I really don't. I know that there's active work that's being done on that, and I think it's going to be in our lifetimes. We're probably going to see something along those lines, which will put people like me out of business. But that's fine.